Hey everyone, and welcome to This Explainer. Today we're going to dive into something so many of us deal with, but so few really understand: back pain. If you've ever wondered what's actually going on under the hood when your back just suddenly gives out on you, well, you're in exactly the right place. We're going to break down the whole shebang: the science, the symptoms, and the solutions for intervertebral disc herniation. I want you to think about this for a second. Why on earth can a tiny little spinal disc, literally sitting squarely in your lower back, cause an agonizing, burning pain all the way down to your toes? I mean, it almost feels like a glitch in our biological wiring, doesn't it? Like, how does a localized issue in your spine translate into severe radiating pain down your leg? Let's unravel that mystery together. So here's our roadmap for today. We'll start with spinal anatomy, then look at how herniations happen, cover pinched nerve symptoms, flag some medical red flags, and finally wrap up with diagnosis and treatment. All right, let's jump right into section 1, spinal anatomy. So your spine is essentially this incredible stack of 33 bones, which we call vertebrae. And right between these bones sit these little cushion-like structures called discs. Now, take a look at how tightly packed everything is in there. The spinal cord and all those nerve roots, they run directly behind these discs. So you can imagine, if a disc gets squished or loses its shape, it has literally nowhere to go except straight into that super sensitive nervous tissue. Let's zoom in on the disc itself for a second. It basically has two main parts. You've got the outer layer, the annulus fibrosus, and this is made of these really tough, flexible rings of tissue that control movement. But inside that, that's the nucleus pulposus. It's this softer, almost toothpaste-like center that acts as your body's shock absorber. When you jump or run or lift something heavy, that jelly-like cord takes the hit and absorbs the stress, while that tough outer ring keeps the whole thing contained. Which brings us to section 2, how herniations happen. Okay, so think of this as the toothpaste effect. A herniated disc happens when that soft inner jelly, the nucleus pulposus, actually squeezes outward through a tear in the tough outer layer. It's literally like squeezing a tube of toothpaste so hard that the plastic just splits and the paste oozes out. And here's the kicker: once that inner material escapes, it physically crushes the spinal nerves right next to it. And on top of that, it releases inflammatory chemicals that severely irritate those nerve roots. It's basically a double whammy of pain. So, you might be wondering, what causes that outer layer to tear in the first place? Well, it's usually this perfect storm of sudden trauma, like, say, lifting a heavy box with terrible form, combined with long-term wear and tear. As we age, our discs just naturally lose water and flexibility. But things like obesity, sitting at a desk all day, bad posture, and smoking, those vastly accelerate the breakdown. Even jobs with heavy manual labor or lots of vibration put massive cumulative stress on these poor discs. Now for section 3, pinched nerve symptoms. The absolute key term you need to know here is radiculopathy. We are not just talking about a dull, annoying backache. No, when a nerve root is compressed or inflamed at the spine, it fires off this sharp, burning, electrical pain that literally cascades all the way down the nerve pathway, right into your arm or leg. Actually, if you were to create a short video for 15 seconds with intervertebral disc symptoms, it wouldn't be someone holding their back. It would be someone grabbing their leg, wincing from a sharp, shooting pain radiating all the way down. Throw in some tingling or numb toes, a leg that feels physically weak. I mean, even just coughing or sitting down can make the pain completely spike. Those right there are the classic, truly agonizing hallmarks of a herniated disc. Moving on to a very important part, section 4, medical red flags. Now pay close attention here, because sometimes a herniation is so massive, especially if it blows straight backward into the spinal canal, that it compresses this entire bundle of nerves at the base of the spinal cord. This bundle is called the cauda equina, or horse's tail. When this gets crushed, it's known as cauda equina syndrome, and guys, this is an absolute drop-everything neurological emergency that requires immediate surgical decompression. So how do you spot it? The warning signs are extreme, and you need to seek emergency care right away if you notice them. First is bilateral leg weakness, meaning both of your legs are literally giving out on you. Another huge red flag is what doctors call saddle anesthesia. Basically, that means numbness in the areas of your body that would touch a saddle, like your perineum and inner thighs. And finally, any sudden loss of bowel or bladder control is a massive sign of extreme nerve compression. There's a very specific warning straight from the medical literature that I want to emphasize. It says, do not wait for white flags. These indicate late, often irreversible cauda equina syndrome. What they mean is neurological damage happens fast. If you wait around until you have complete urinary retention or total numbness, well, that nerve damage might already be permanent, leading to lifelong disability. Timing is everything here. Do not wait. All right, taking a breath, let's head into Section 5, Diagnosis and Treatment. Okay, some good news. An incredible 85 to 90% of acute herniated disc symptoms actually resolve entirely on their own within about 8 to 12 weeks just using conservative management. Believe it or not, your body's immune system will literally clean up and resorb that escaped disc material over time. You really just have to give your body the right environment to heal. When it comes to diagnosis, we rarely start with expensive imaging. A doctor or physical therapist will usually just do clinical exams, like the straight leg raise test. Basically, by raising your leg while you lie flat, they stretch out that sciatic nerve to see if it reproduces your radiating pain. And surprisingly, MRIs aren't even recommended right out of the gate, unless you've got those scary red flags we just talked about, or if your symptoms stubbornly hang around past 6 weeks. So what does the path to recovery look like? Well, it generally follows 3 steps. Step 1 is always conservative. We're talking anti-inflammatory meds, modifying your activities so you aren't doing any heavy lifting, and eventually physical therapy to build up that core strength. Now, if the pain is just totally unbearable, step 2 is interventional, like getting an epidural steroid injection to calm down that furious nerve inflammation. And finally, only if those fail or if you're getting progressively weaker, do we move to step 3, surgery, like a discectomy to go in and physically remove the piece of disc that's crushing the nerve. For folks who do end up facing the choice of surgery, the data actually offers a really fascinating perspective. See, surgery often gives you much faster relief from that intense radiating pain during the first year, but when we track those same patients 1 year out and beyond, the long-term clinical outcomes between people who had surgery and those who stuck it out with conservative care are remarkably similar. Ultimately, your body has an amazing built-in capacity to heal the disc, as long as you give it enough time.
Which brings us to our ultimate takeaway. Your spine is an absolute marvel of biological engineering, right? But those little shock absorbers definitely have their limits. The cumulative load of sitting slumped at a desk all day or picking up heavy things without bending your knees, it slowly, silently damages that tough outer ring day by day. So I want to leave you with this question. Could making simple, conscious changes to your posture and lifting habits today save your spinal nerves from agonizing pain tomorrow? Thanks so much for hanging out with me for this explainer, and as always, stay curious.